Hello, I'm Josh Newman, physician assistant with Dr. Brett Taylor, a fellowship-trained, board-certified surgeon at Town & Country Crossing Orthopedics. With over 15 years of professional experience in workers' compensation and litigated spine care, Dr. Taylor understands the accuracy and scientific clarity required in these cases. He has created the Taylor Spine Team, which is composed of competent and considerate healthcare providers that are dedicated to providing top-tier spine care to injured individuals. Town & Country Crossing Orthopedics offers precision-based spine care, which focuses on the patient as an individual. Dr. Taylor evaluates patients from a variety of backgrounds and cultures. He works closely with patients, spending time thoroughly explaining their treatment options and always giving opportunities to ask questions. New patients will spend significant time with Dr. Taylor, Lori Burke, RN, Workers' Compensation Coordinator, and me. We focus on patient expectations and accountability. Prior to surgery, a timeline is signed by the patient outlining expectations, expected return to work, and maximal medical improvement. Through an evidence and precision-based medicine approach, our work speaks for itself. Thank you for watching. Dr. Taylor will be speaking next on a topic important to us at TCCO.
Hello, I'm Dr. Brett Taylor, and I'd like to discuss a serious problem affecting every strata of our society today: opioid use, abuse, and addiction, and what we can all do together to make a difference in this crisis. Opioid usage in the United States is an alarming crisis. Opioids to treat non-cancer chronic pain are not proven by science. These medications are not as safe as the public believes, and the risks of addiction and overdose are very high. Furthermore, individuals who choose to treat their chronic back problem with opioids risk a condition called opioid-induced hyperalgesia. In essence, these patients develop increased pain due to their use of opioids. In my practice, I frequently see opioid-addicted individuals who are lethargic, depressed, constipated, with poor memory, muscle atrophy, hormone imbalances, mood swings, and insomnia. Their symptoms can all be due to opioid abuse. Many would ask, why do doctors prescribe so many opioids to non-cancer patients? The pharmaceutical industry and the government strongly influenced physician prescribing behaviors. When pain was declared as the fifth vital sign, it became common for doctors to treat ordinary musculoskeletal pain with narcotics. Some doctors felt mandated to provide compassionate care in the 90s, and this compassionate care included the use of opioids. Some doctors felt they were at risk of losing their license if they did not prescribe opioids to treat chronic pain. There was also the misinformation from the pharmaceutical companies that opioid use would not result in addiction. This false notion has contributed to the epidemic of opioid overuse and addiction. The U.S. population has been flooded with opioids. Despite new studies suggesting the detrimental effects of opioids, a few outlier physicians continue to overprescribe life-threatening quantities of opioids for musculoskeletal chronic pain. We are losing generations of young people in this country due to opioid abuse. Often, this opioid abuse was started in a doctor's office or with a doctor's prescription. Some individuals who try to stop their opioids experience withdrawal with nausea, respiratory issues, fever, chills, diarrhea, anxiety, depression, and sometimes even death. Opioid abuse is a difficult habit to stop, and it may require medical assistance to stop. It's impossible to determine if a person will become addicted simply based on his or her appearance. Addiction is a medical diagnosis tied to one's genetics. Addiction is not related to a good person or a bad person. Addiction has a genetic connection tied to our genes and our family history. Opioids are no better for chronic pain than anti-inflammatories. When you become addicted to opioids, your brain chemistry is permanently changed, and often you need treatment with another drug, buprenorphine, an opioid antagonist, to get off of opioids. In my practice, opioids are used for a maximum of 8 weeks following major spine surgery. After 8 weeks, patients are placed on an anti-inflammatory and/or muscle relaxant. Patients also sign an opioid contract, with prescribing parameters which are outlined, and that way accountability is established. I've also used multimodal analgesia for my spine surgical patients for many years. This includes pre-surgical non-narcotic medications such as intravenous Tylenol or Toradol, and local long-acting numbing medications injected into the wound. This approach decreases the opioid requirements for post-surgical pain. While the health of your spine is at the core of what we do, safeguarding the overall health and the health of our community is vitally important to us.
Hi, I'm Alyssa Visconti, Administrator at Town & Country Crossing Orthopedics. In addition to orthopedic spine surgery, Dr. Taylor also offers supplementary services such as IMEs, chart reviews, and case evaluations. New patients as well as IMEs can expect to be seen within 10 business days of request and finalized notes completed within 5 business days. Every effort is made to maximize appointment efficiency. We also offer day of appointment work status reports and immediate accessibility to Dr. Taylor and his staff through numerous channels. At Town & Country Crossing Orthopedics, case managers are welcomed. We offer an inviting case manager lounge. To experience better spine care, contact Town & Country Crossing Orthopedics. Watch for our upcoming videos in this 12-part video series, and thank you for watching.